okay? Oh my god, you are bleeding so badly. Okay. Oh my gosh, get me out of here. Panda, get me out. You okay? You okay? Oh my god!
It's time to wake up, little lady. Rise and shine. What is your problem?
I can't do it! No!
What is it? Oh, the light. You're good. You're good. You're safe.
So, you ready to go to the mall?
Yeah, let's go.
You got a sick ride, Gina!
Woo!
Okay, so I'm not exactly sure how to get there. Okay, well, we have to make a left-hand turn up here. Okay. I said left, not right. Oh, I did. I'm going the way I was supposed to go. Where are you going? I said make a left. You went right. I can't make a left. Why? Because I can't. How do you get anywhere? I just always make right turns. Like this.
Do you want to go outside to the park?
I'm not going any farther. You didn't say anything about needing water here.
That's fine. Come on, let's get in.
I'm
on.
afraid. I can't swim.
Come on, let's get in the water.
Come on, you can't do it.
Yes, you can. Come on. It's fine. You're fine.
Is that okay? Yeah.
The definition of a phobia is an exaggerated, usually inexplicable, and illogical fear of a particular object, class of objects, or situation. The symptoms of phobias are feelings of panic, dread, horror, or terror.
Recognition that the fear goes beyond normal boundaries and the actual threat of danger.
Reactions that are automatic and uncontrollable, practically taking over the person's thoughts.
Extreme measures taken to avoid the feared object or situation.
Rapid heartbeat, shortness of breath, trembling, overwhelming desire to flee the situation. And all the physical reactions that are associated with extreme fear.
How does someone develop this disorder, you may ask?
Genetics. They can play a role in phobias, and it may run in the family.
Cultural factors. Some phobias can only occur in certain cultural groups.
Life experience. Many phobias are based on real-life events that may not be consciously remembered.
How many people in the U.S. have this disorder?
5 out of every 100 people in the U.S.
Between the ages of 18 and 54, 3.7% of people have social phobia.
4.4% of people have a specific phobia, and 2.2% of people have agoraphobia.
Treatments for phobias. Exposure therapy, also known as systematic desensitization, is exposed in a safe and controlled way to overcome fear. About 75% of people overcome their phobia. The second kind of treatment is participant modeling. The therapist models healthy ways of interacting with a feared object. The third type of medication is anxiety medications, which is started towards the beginning of therapy.
What is the history of this disorder? The word phobia is Greek. No one is sure who discovered phobias. In fact, it can be traced back to the writings of Plutarch.
He wrote that Pythagoreans interpreted phobias as recollections from former lives. What is the severity of a phobia? Phobias rarely cause considerable distress or a significant disruption of everyday activities. You can get therapy for it. Dying from having a phobia is not common, but depending on the severity, it is possible.
What is being done right now about the disorder?
There is a drug compound called D-cycloserine in combination with exposure-based therapy.
It may allow people to more easily break down association between situation and fear.
With CBT treatment and antidepressant medication, about 80% of social phobias can be alleviated and their symptoms go away.
A famous person with a phobia is Pamela Anderson. She has the phobia of mirrors.
Her phobia is probably a fear of seeing her own reflection, and she can't stand watching herself even on TV.
And she even leaves the room if the channel isn't changed.
What brings you here today, Miss Monique?
I'm afraid of dogs.
How afraid?
Definitely afraid.
There was an incident about 2 years ago, I think. I was at this park, and this like huge dog, I don't even know what it was, it came up and bit my toe off.
Let me see.
I lost my big toe.
I see that.
I have a nub now.
That's horrible. Well, today I'm just going to start you off then with drawing a picture of a dog, and we'll see how good you do with that. So here's a marker, and there's piece of paper, and draw the best picture you can of a dog.
Oh, wait, I can do
Yes, you can do it. Keep going.
It's scaring me.
You're soon done.
That's the part that bit off my toe.
Well, you'll be okay. You're good.
Oh my gosh, I can't do this.
You're fine. Are you done?
I think.
This is a very good picture of a dog. Good job. That's step 1 and you completed. Come in. Hi, Monique. How are you today?
Great.
You don't seem so sure about that.
That's scary.
Okay, well, I'm glad you came back for day 2 of exposure therapy, and today we are going to move on to a book of dogs, and you'll have to read a little bit more about the dog. Okay, so start reading some of it to me.
Out loud?
Yeah.
Is there pictures?
I'll let you find out for yourself.
This dog, it ran really fast. And it bit off my toe.
Not in the book, Monique. It didn't bite off anyone's toe. Explain the picture to me.
There's a big dog and a little dog. It looks like they're playing ball of some sort.
Oh, that's good. You're doing a very good job with this right now. You're already moved on to step 3. I need you to look outside this closed glass door and see this dog that we have here. How do you feel about this dog?
Wants my other big toe?
No, it doesn't. You're fine,
I think it does.
No, you're fine. He's just barking. He's just barking. Come here. No, come here.
It's already
Kneel down, kneel
coming
down. Kneel down.
It's looking at my toe.
Look at it, look. Aw, he's pretty. Step 6 is to look at the dog through a partially open window. How do you feel now?
Alright. It's a little scary when it barks at me.
That's just what dogs do. You're fine. Can you kneel down again, face to face a bit? Oh, if you look.
As long as it's far away from me.
No, just kneel down. Talk to it.
I can't talk to it.
Hey, Stevie. Step 7 is to just look at a dog in a different room. How do you feel looking this close to the dog? There's no glass dividing you.
I'm alright.
Is this alright?
Yeah. I can look at it. As long as it's not barking.
Okay. So come on in here. And how do you feel?
I feel a little better about this.
Feeling better?
Yeah.
I'm afraid of the dark.
I'm afraid of being a complete failure.
Can you please go?
Afraid of cameras and Teletubbies.
I have a phobia of spiders.
I have a phobia of thunderstorms. I have a phobia of the winged monkey creatures from The Wizard of Oz.
I have a phobia of feet because they're the most disgusting thing and they're crusty and gross and sweaty, so don't put them near me.
I have a phobia of people touching my neck. Touch me. I like when I hit them. It gets like itchy and scary. I have a phobia of being blindfolded. I have a phobia of spiders. I am afraid of clowns. I have a phobia of ants. I'm definitely afraid of tanning beds. I'm scared of roller coasters.
I have a phobia of heights.
I have a phobia of kidnappers.
I have a phobia of stigma.
I have a phobia of swimming in really creepy ponds.
I have a phobia of the United States.
I have a phobia of tight spaces.
We have a phobia of redheads.
I have a phobia of snakes.
I have a phobia of rabbits.
I have a phobia of tanning beds.
I have a phobia of people videotaping me.
I have a phobia of heights.
I have a phobia of having phobias. Ah!
I have a phobia of drowning in my car.
I have a fear of blood.
I have a phobia of failure.
Yeehaw!
If you have a phobia of the dark,
Make the laughter! No, I can't.
Class of some object?
you gotta start
That
over.
doesn't make sense.
Your turn. Your turn. And all the other physical reactions that are associated with extreme fear. Alright, that was funny, but I was like, your part is next. Like, why'd you just run away?
And watching herself on television, and she even leaves the room if the channel isn't changed. Okay, you should not have put the dots in there.
There was this huge dog, and it came up and mauled my leg. I lost a leg from a dog.
Really?
Yes. Let me see.
I can't show you. I can't do this. You can't laugh.
You can't laugh.
We have a phobia of calculus.
When people touch my neck. I don't like it. I have a phobia of him.
I have a phobia of crazy ex-girlfriends.
Oh, the ghost.
Blood.
Blood.
I don't like it at all. Done.